Hi, everybody. It's Dr. Molly of Birmingham Pediatrics and Campground Pediatrics, and I want to go over a couple other things related to, guess what, coronavirus. I know that there's been some questions about testing and about school closings or potential school closings, and so I wanted to cover some of those questions. I know people are wondering about who can be tested and why people should be tested, so let's talk about that first. Right now, coronavirus testing needs to be cleared by the health department. What that means is that if a patient comes into any facility, whether it's a hospital or a doctor's office, and is sick with symptoms that could be coronavirus, the provider seeing them needs to contact the health department and talk through those symptoms and risk factors, including things like travel or exposure. And then, in conjunction with the health department, a decision is made about whether or not testing is going to be done. As of right now in Michigan, testing is only being done on cases that are either people severely affected or people who have had contact with a known COVID-19 infected person, or people who are very, very severely ill, some healthcare workers, things like that. So even someone who really does fit the criteria of potentially having COVID-19, for example, having all the symptoms and testing negative for all the other types of viral illnesses that are floating around right now that we're able to test for, if they're not severely ill and they don't have a clear path to exposure, they're not likely to get approved for the test at this time. I know that can be frustrating for people and it makes it less clear about how careful they need to be, but in general, if you're feverish and coughing and sick, you should be excluding yourself from the community anyway. You're not probably contagious until you're developing symptoms regardless. So relatives of the person who's sick can still go about their usual daily life unless they themselves develop symptoms. I hope that clears up some of the questions about testing. Now on to school closures. There's been a lot of concern about school closures, both on the why would they do it and why won't they do it side of the equation. So I want to explain the pros and cons of school closures, not at the university level, but at the local level for high schools, elementary schools, that sort of thing. Kids are not ill-affected much by coronavirus, so closing schools locally probably isn't really to benefit children. Children aren't going to get particularly ill from this virus. And even the faculty and staff members at the schools that we'd be talking about, there aren't enough of those faculty in high-risk categories that closing the schools would be necessary even to protect them. They could have individual faculty or staff members who would be in high-risk categories take a leave of absence, for example, in order to protect themselves. So the thought behind closing schools at this point or any point in a coronavirus outbreak or other outbreak is to decrease spread in the community, to protect other high-risk category people. So in other words, because children aren't heavily symptomatic with this virus, they may still get it and be mildly symptomatic and spread it throughout the community, causing low-level illness, and that would spread throughout the community. By closing the schools, you decrease spread from person to person, even at low levels, and therefore decrease spread in the community at large. If schools decide to close, and that's a big if, it's not a reason to panic. It doesn't mean that the disease has gotten any worse or that it's more prevalent in our community than it was 2 days ago. It just means that the powers that be have decided they want to try to decrease spread in the community to protect the fragile people in our community, the elderly people and people with underlying health conditions. I'm not sure what the school superintendents are going to decide to do, whether they're going to decide to do a leave of absence from school for a period of time or not. But whether they decide to or whether they don't, it doesn't mean that your children or your family are at any greater risk. The only reason to do it would be to protect the fragile people in our community. So keep that in mind. Don't panic. You don't need to hoard medicine or hoard toilet paper. You will still be able to go to the grocery store on your own because you won't actually be quarantined or sick. Just because school isn't in session doesn't mean you're going to be locked inside your home. So keep that in mind, and I hope this gives you some idea of what the thought process is behind decision making around school closure. I'm Dr. Molly with Birmingham Pediatrics and Campground Pediatrics.